Thank you very much for joining us in our 6th CMR webinar. In this, we're going to look into the role of T2 star imaging in cardiac iron overload. In this, we will follow consensus statement from the American Heart Association, also endorsed by Society of Cardiovascular Magnetic Resonance. These recommendations are based on the evidence which has been predominantly derived in cohorts of patients with beta thalassemia major, genetic condition caused by severe reduction or even absence of beta globin chain, and on the other hand, excess of alpha globin chain, leading to ineffective erythropoiesis and resulting in severe anemia requiring lifelong transfusions. On average, patients undergo 8 transfusion events a year, with each unit contributing an excess of iron to the total body storage, causing subsequent iron overload-related complications. The most relevant iron overload complication is cardiac dysfunction, which is the predominant cause of death. Iron chelation therapy not only helped to improve survival, but also improved understanding into the natural history of cardiomyopathy. Important was the recognition that complications due to cardiac iron overload are preceded by years of clinically silent iron accumulation. Once the symptoms appear, the treatment is rather ineffective and prognosis is poor. Targeting asymptomatic stage is supported by several lines of evidence. Firstly, iron chelation therapy can completely restore cardiac function in most patients with preclinical dysfunction, and only some with overt heart failure. This knowledge comes from the longitudinal observations in patients started on iron chelation therapy, showing that dimensions of left ventricle at diastole and systole can be reduced and even normalized if treatment is started in time. Second important information relates to the lack of improvement in systolic function with iron chelation therapy. Also revealed in these 2 representative cases requiring many years of treatment for restoration of left ventricular dimensions. And finally, that the best results of treatment are achieved when the treatment is initiated prior to the onset of symptoms. Natural history of cardiomyopathy due to iron overload, as well as the fact that the greatest treatment opportunity is within the asymptomatic stage, necessitates early recognition using a reliable diagnostic strategy. Standard heart failure tests are limited in supporting early recognition of cardiac iron overload cardiomyopathy because they are non-specific for this condition, as well as employed late in course of disease. Cardiac T2 star measurement by cardiovascular magnetic resonance is the method of choice for assessment of cardiac iron overload cardiomyopathy. It is a measure of tissue magnetic properties, or T2 relaxation, and represent the decay of signal with time in a transverse manner after the spins have been allowed to return and align themselves in the orientation of the main magnetic field, that is, in feet towards head orientation of an imaginary patient lying in the bore of the scanner. T2 star value is the time at the time point when signal decay reaches 63% of its original magnitude. T2 star relates to the T2 relaxation via T2 prime, which is particularly sensitive to local tissue magnetic inhomogeneity, which is affected and disturbed in the presence of free iron, manifest as faster T2 star decay and reduced T2 star value. Cardiac T2 star measurement relates directly to the cardiac iron content by way of evidence of a relationship between T2 star and its inverse value R2 star with whole heart iron content. T2 star measurement relates to cardiac function, or more precisely, cardiac dysfunction, with T2 star values of less than 20 being closely followed by a drop in left ventricular ejection fraction. T2 star measurements relate to the relevant cardiac events in the context of cardiac iron overload, including arrhythmia and heart failure. as shown in a multi-center observational study of 21 UK centers, revealing an important increase of relative risk for heart failure with a cutoff value of T2 star at 10 millisec, as well as for arrhythmia with a cutoff value for T2 star of 20 millisec. And finally, using cardiac T2 star measurements to guide iron chelation therapy has led to a considerably improved survival compared to historical cohorts of patients with beta thalassemia major. Cardiac T2 star acquisition is one of the simplest in cardiovascular magnetic resonance. Gradient echo T2 star sequence with multiple echoes to map out the decay of T2 relaxation is obtained in a single midventricular short axis slice, usually requiring a single breath hold. Co-registered echo images are then used for placement of a region of interest within septal myocardium. Because of the rather uniform distribution of iron within a heart muscle, septal T2 star measurement is fully representative of whole heart iron content. Normal values have been established for 1.5 Tesla field strength. The relevant cutoff of 20 millisec on one hand corresponds to the lower end of the reference range, and onset of clinically relevant events such as arrhythmia and heart failure on the other hand. Myocardial T2 star measurements can inform on the risk of cardiac complications in susceptible patients and provide basis for treatment with iron chelation therapy according to the cardiac T2 star levels. Cardiac T2 star measurement of less than 20 millisec indicates the presence of cardiac iron loading, which means that the patient is at risk of developing cardiac complications, and indicates the need for initiation of iron chelation therapy. Cardiac T2 star measurement of less than 10 millisec corresponds with a high risk of cardiac complications. Intensified to maximize the iron chelation therapy is required. Cardiac T2 star measurements have a role in monitoring the response to treatment. By following the progress of iron clearance, which occurs much more rapidly compared to the improvement in systolic function, avoiding erroneous impression of ineffective treatment and premature discontinuation of therapy. In summary, we've looked at the fundamentals of cardiac iron overload and its natural history in beta thalassemia major, as well as the most relevant cardiac complications, including arrhythmia and heart failure. We've looked at the role of iron chelation therapy by being employed in asymptomatic stage of disease, guided by cardiac T2 star measurements. Here comes the list of papers that I've used in today's presentation. With this, I would like to thank you for your attention.